So let's talk about meningitis. Okay. First of all, what is meningitis? Meningitis is an inflammatory infection of the meninges. Okay. So what are the meninges? So the word meninges means membrane. And this membrane is made up of three layers. The outermost layer is the dura mater, followed by arachnoid mater, and finally pia mater. So in the picture you could see the dura mater, followed by arachnoid mater, followed by pia mater. Okay, now note that in between the arachnoid mater and pia mater is a space called subarachnoid space. The subarachnoid space contains cerebral spinal fluid. The cerebral spinal fluid, we use it to help us diagnose the etiology of meningitis. Okay. Pathogenesis. How does it happen? First of all, the central nervous system is anexic, which means it does not harbor any normal microbiota. So what are the steps in the pathogenesis that lead to meningitis? First, colonization. The bacteria that can cause meningitis most often first colonize the respiratory tract mucous membranes. This is followed by invasion into the bloodstream. So the pathogens enter the bloodstream, followed by immune evasion. That means that through evasion of our immune system, the pathogen is able to survive in the bloodstream. Then, the fourth step, entry into the subarachnoid space, most commonly via blood following bacteremia. Okay. Note that only certain bacteria can cross the blood-brain barrier, and they are Neisseria meningitidis and Streptococcus pneumoniae. Etiology. Okay. Because viruses are small, they can more easily cross the blood-brain barrier, and therefore viral infections of the nervous system are more common than bacterial or fungal. Okay? Viral meningitis. Okay? We use the word aseptic meningitis. The word aseptic meningitis means meningitis caused by a pathogen other than bacteria. Okay, most commonly a virus. Okay, viral meningitis also causes the typical presentation we see in a meningitis case: fever, headache, stiff neck. But viral meningitis is less severe and not as life-threatening as bacterial meningitis. The most common virus that causes viral meningitis is enteroviruses, which are transmitted via fecal or respiratory contamination of food, water, or hands, and can spread via the bloodstream to infect the meninges. Okay? Now, bacterial meningitis. The most common bacterial disease of the nervous system is bacterial meningitis. Bacterial meningitis most commonly infects the pia mater and arachnoid mater. Bacterial meningitis is much more severe and more life-threatening than viral meningitis. The most common causes of bacterial meningitis by age: less than 1 month old. The most common causes are group B streptococcus, followed by E. coli, followed by Listeria monocytogenes. These are common causes in neonates. From the age of 3 months old to 35 years old, the most common causes are Streptococcus pneumoniae and Neisseria meningitidis. From 40 years old to 65 years old, the most common causes are Streptococcus pneumoniae and Listeria monocytogenes. It's important to note that in the immunocompromised population, the most common causes are the Streptococcus pneumoniae and Listeria monocytogenes.